Welcome to Voices for a Healthy Legacy, where we have discussions about health and wellness with relatable medical professionals. I am your host, Dr. Andrea, a board certified family medicine physician, and today's guest is none other than Dr. Delicia Munfus-McCray. All right, well, welcome to the show. I'm so happy to have you here today. Fun fact, Delicia or Dr. Delicia and we did clinicals together when we were in medical school, and then we just reconnected on social media, and here we are today. So, welcome to the show.
Thank you for having me.
You are so welcome. So, tell us a little bit about who you are, and tell us a little bit like a fun fact that you want everybody to know about you that they may not think that they may not associate with a pathologist. So, go ahead.
Right. So I'm an adult pediatric and perinatal pathologist. I'm a mom of two boys. I also have an angel daughter who was stillborn. I write children's books. I'm a small special needs advocate for special needs children. And one fun fact, I coach girls wrestling.
Yes.
I've done that for about 4 years.
Okay. Okay. Now, I'm curious. Did you wrestle? How'd you get into that?
Actually, my son started wrestling, and of course, he was about my size, so we started grappling, and I was recruited to be one of the coaches. And I've been coaching ever
Okay.
since.
Okay, awesome, awesome. And so you're going to continue like as he goes through the course, or do you have like a cutoff time of when you're going to do
It's
that?
funny, he doesn't wrestle anymore.
Oh, he does. Oh, so you,
Yeah, right now I'm trying to grow girls wrestling. So I actually have 7 girls going to the state championship this weekend to compete for the top girls in the state of Alabama. So I coach
oh,
elementary school,
goodness.
middle school, and I've helped with the high school team as well.
That is awesome. I love that. I love that. I don't know if I could do it, but I love to hear that you're doing it. All right. So just kind of tell us, like some people have never met a pathologist. They may have heard of like a pathologist, but they don't know exactly what a pathologist does. So what do you do as a pathologist? We'll get into a little bit more details, but kind of give us a general overview of that particular specialty.
So a general pathologist is kind of a medical detective. So unlike a lot of doctors who see a patient in an exam room, what we actually do, we study blood, we study urine, all kinds of body fluids and tissues to determine why a person's sick, if the person has cancer or not, and to determine the best treatment. And unfortunately, sometimes we also determine the cause of death. So we actually are what they call the doctor's doctor. We give doctors the information they need to treat patients and take care of patients.
Okay. Now, I am curious, how did you get into pathology? Well, take us back a little bit and tell us how you became interested in medicine and then later pathology. How'd you choose that?
Well, actually, another fun fact, when I went to undergrad, I was going to be either a doctor or a dancer or a clown. So I didn't really know
Fitting.
what to do. And I was a cheerleader, I did gymnastics, and it actually was a marine biology course. I realized I enjoyed science. So then after
Mm-hmm.
a lot of research, somebody told me, have you ever thought about medical school? So I actually got my PhD before I got my MD. And then in medical
Okay.
school, I realized I liked the intellectual part of it, but going and seeing patients wasn't the funnest for me. And it wasn't that I didn't like people. For me, it kind of frustrated me that people wouldn't take medicines you tell them to. They didn't necessarily listen to advice, but I wanted to give the answers that people needed. So I realized I went for the kind of nerdy aspect of medicine and just wrote memorization, articles, research, and decided I want to help doctors who like being with patients every day, who have that heart and have that feeling to be with patients, and for me to be the person to give them the answers they need.
Okay. Well, that definitely would be me because we need you all. Like a lot of times you're that last piece of the puzzle that we need, to figure out what's going on or at least give us the next step. So you all are very crucial in everything with us, like day to day. So, when people are getting labs and, biopsies and all of that things, those things come to you all, right?
They do.
Or
They do.
you're over a lab that does that, and like you can get like there are certain things that are standard, but aren't there certain things that need like your expertise in order to like complete that part of it from the lab aspect?
Right. So we are the ones who run the tests, make sure the tests are accurate. But one thing a lot of people don't think about with pathology, we're the ones who tell the doctors you have cancer or not. So a doctor can't say you have cancer unless you have a microscopic diagnosis. Also, with
Gotcha.
things such as cancer, we're the ones who tell the doctors the best treatment for the cancer. So we got chemotherapy, radiation, and basically the next step. And
Okay.
also, we're the ones who do genetic testing.
Okay. Cool. And we hear a lot of buzz about genetic testing now. So can you talk a little bit about why you think that is something that we're hearing more about and how important it is, like in the grand scheme of things?
Well, genetic testing is important very much so in cancer because we're realizing more and more not every cancer is the same. And of course, not every patient is the same. So we do genetic testing for more personalized medicine. So if somebody has a cancer, but then they have certain genes, we can determine what chemotherapy works best for them. That's one reason a lot of people are doing a lot better with chemotherapy. Not everyone's losing their
Mhm.
hair, not everyone's dying from it, because we can determine what chemotherapy, what dosage is actually best for the patient. And then, of course, the oncologist gives us extra information to tell us how well the patient would do with certain chemotherapies. So we kind of help guide the therapy. And that's one reason people are doing a lot better with chemotherapy. And genetic
Awesome.
testing helps with determining if there's something wrong with somebody, if there's a chance of a sibling having something that one person might pass of. So it's helping a lot of people in personalizing medicine overall.
Good. And in those cases, if you're noticing like a certain gene mutation or anything that's a little bit different, that can help other family members, would you recommend that they speak with their primary care physician to see if they should consider getting testing, or when should someone consider genetic testing?
Well, usually we do that. We put that in our pathology reports and we also let the physician know. So whoever submitted the tissue, we call that physician and we actually recommend genetic testing. We can tell them what genes to test for, so which saves a lot of money. So instead of testing for every gene in the human body, we can say test for these certain genes and maybe the siblings, or we can tell them it might only be in boys and not in girls. So we kind of guide the genetic testing as well. But we're the ones we tell the clinician to do genetic testing, they contact the patient.
Okay. So you're that missing piece of the puzzle. You're saving us. Helping us to be a little specific with the testing, which can ultimately save us money. Who
Lots
would
of
have
money.
known that?
Lots of money and lots of time too.
Yeah, yeah. Okay. All right. And so you do adult, perinatal, and pediatric pathology, correct? Is
Correct.
that correct?
That is correct.
Okay. And so is that something that someone commonly does, like all of those, or did you choose to do all of those for a specific reason?
Well, I chose all this for a specific reason. First, the average pathologist does adult pathology. There's a couple of hundred pediatric pathologists in the United States. There's not a lot of us. So I chose that because I love pediatrics and kids are not the same. They're not smart adults. Kids are very different, but also I love babies as well. So in my pathology training, I realized that there's a whole nother aspect of pathology I wanted to be exposed to. So I went to Children's Hospital of Philadelphia, CHOP, and I learned the different diseases for children and also perinatals, a baby in the womb, so before birth. So I can actually diagnose from in the womb all the way to death or older age.
Okay. So you're like, this might be showing my age, like Inspector Gadget, like you're looking into.
That's what it feels like too.
You remember Inspector Gadget, right?
Yeah, I do. I do. But yeah, I mean, I tell people we're medical detectives. I mean, I can tell you what happened to a baby before the baby comes out. And that's
Okay.
one thing that, especially since I lost my daughter, I like to give parents that closure so they know what happened in the womb as well.
Okay. All right. And speaking of that, were you able to get some closure? And you don't have to go into it deeply, but I know you help other families kind of figure out what's going on. Were you able to have that investigation done in that instance to kind of help you know what's going on?
I did. I did. And actually, after my daughter passed, of course, she had an autopsy, which is called a non-invasive autopsy. That's an autopsy that I specialize in, but you never actually cut the body. So she had a non-invasive autopsy. So I'm passionate about getting non-invasive autopsies out there because as a mom, as a pathologist, I know what autopsies are. But as a mom, I wanted my somebody to treat my daughter in a respectful way and not cut on my daughter. So that's my specialization, is non-invasive autopsies.
Okay. Will you go a little bit more into that? Because we have heard and we've seen like what we some people may not know about that just because of the, I don't know if you would even call it traditional, but what we're used to as, the autopsy. So talk a little bit more about that particular one.
So a typical autopsy, which most people know about, is when they actually have to cut on the body and take organs, things like that. What I call a non-invasive autopsy is you actually do a medical correlation and do imaging. So you have somebody like me examine the body. I never have to cut the body, but if you have a thorough medical history, you have an expert in the field, and you do imaging. Sometimes we do MRIs, sometimes we do X-rays, and different tests, and also blood tests to determine what actually happened. So 80% of the time, especially for a baby, you don't need an autopsy. Well, you don't need an
Mm.
invasive autopsy. So it allows us to have the baby never leave the hospital. You don't have to worry about your baby being cut on or anything. You have somebody who will take care of your baby in the way that you would as a mom.
Oh, that is awesome. It's almost like um, a different perspective that I'm sure if people knew about, they would want to know whether or not that's an option. And are there times when that is not an option? Because some people don't know that that exists or that they can even ask if it's a possibility depending on what's going on.
Sometimes it's not an option, but to get the option, I would say that the hospitals and also the OBs have to advocate for that option. So a lot of people traditionally go for just general autopsies, and a lot of people don't want general autopsies. But unless the hospitals and the OBs know it's available, and also patients know it's available, they're not going to request it. So if you don't request it, a lot of times you don't actually get it.
Okay. Okay. And can you walk us kind of like when, let's say, me as a family medicine physician, when I send a sample to the lab, um, and you don't have to go into all the specific details, but just give us an overview because, like, the patients here, we're waiting on your labs to come back. So they don't actually know what happens at the lab. And like I said, you don't have to go into a whole lot of details, but sometimes there are delays. And it's not because somebody necessarily made a mistake, but it could be due to the type of testing or maybe something is, not really giving us a straight answer. Can you give us a little bit of information about that?
So when something goes to the lab, you here, send it to the lab. I tell people there's a whole team behind the lab. So when it comes to lab, we want to make sure that that specimen is actually from that patient. So we have to barcode it and scan it, things like that. And we have to track the whole specimen through the whole process. Sometimes if it's a tissue specimen, we have to cut into microscopic sections, look at it in the microscope, have a pathologist look at it. For bloods, we put things through different machines, but of course, not every test is available at every hospital. So sometimes you run one test, you need a confirmatory test, another hospital. One thing I always tell people, if we diagnose cancer, we want to make sure that it's definitely cancer. We want to make sure it's definitely that patient. So sometimes there's a delay. If we find cancer, we want to find out what type of cancer it is. And we don't want to give the clinician information up front, not just that it's cancer, what type cancer and what to treat it with. If there's an infection, there is an infection, what's causing the infection, what's the best antibiotic or what's the best antifungal for it. So sometimes there's delays because we're trying to give more information. So sometimes the clinician might get a call from pathologist saying it's carcinoma. We don't know exactly what type. It might take another week or so, but we're trying to give you the information and make it most complete as possible for treatment.
Okay, okay. What are some misconceptions? And I guess the non-invasive procedure is an option, but some people don't want like they want answers, but they want to be able to do things outside of necessarily cutting them open. Is there a situation where you could start out with non-invasive and depending on what answers you get, you can move to like the more invasive one or give them that option, or do you just kind of do everything in that one setting?
So usually if I try non-invasive and I need to have a little bit more information, we can convert to an invasive, but it won't be an extensive invasive type autopsy. For example, sometimes I tell people that I just need to look at one organ. I just need to look at one area. So then I might just make one little cut and then peek inside, and basically just get whatever I need. If I need to do a tissue biopsy from the inside, that keeps you from doing a complete autopsy and just basically taking the baby. I don't want to say taking the baby part, but taking the organs and everything. So I can
Mm-hmm.
go from an non-invasive to what they call minimally invasive. It's like
Okay.
like you have a little biopsy, you take a little kind of piece of something. You don't want to have to examine the whole thing if I don't need to.
Okay. This is such great information. This is really going to help a lot of people because some people, even though we know the person is deceased, we still are just kind of, we're not kind of, we are very protective and emotional and still don't want them to experience any more trauma than they may have gone through already. And so that's really, really good to know that, even if you do need to go a little bit further, you can, sometimes go to one particular area and get what you need, and that's it.
Yeah, I always tell
So
people, I was
that's
like,
awesome.
if I lost my daughter, I understand, I feel it. So I know that when I saw my little baby there, I wanted to know why, but I didn't want people, well, somebody else cutting on my child. I wanted to
Hmm.
know the answers as minimally invasive as possible. So I do the
Okay.
same thing for all of my patients and for all my families as well.
All right. So let's pivot a little bit. So you have M&M Pathology Associates,
Correct.
correct?
That is
All
correct.
right. And tell us how that kind of came to be and what gaps did you possibly see that you could fill with doing that?
Well, I decided to become Eminent Pathology Associates, which is independent, because I realized with my non-invasive and invasive autopsies, I was limited to one hospital system. Being independent, I can go to any hospital within Alabama and actually have license in 6 different states. So I can pretty much help all over, which is great. But having
Do
my
you
own
mind naming those states? Because people may want to know if they don't know this is an option. They may want to know if their state is one of your states. So as of right now, we know that could expand, but right as of right now, what are those states?
Florida, Georgia, Mississippi, Tennessee, Indiana, and I'm missing one. Florida, Georgia, Tennessee, Indiana. Of course, Alabama. I don't know how I missed that one.
Right, right. Okay. And so go ahead. You said you didn't want to kind of, I won't say get boxed in, but continue with why you saw that vision, saw the need, and how you could fill a particular gap.
Well, one thing I realized is when my daughter passes, there's not many perinatal pathologists. And I wanted to get the information out because people, I always tell people, not just people in Birmingham, but people all over are having stillborn babies all over. So I knew that me being myself, by myself, I could be independent. I can go to any hospital I want to. Since I had the non-invasive autopsies, I can bring that and also remote services. So I do remote autopsies as well. So using video cameras and collecting information, and it allows me to kind of spread my expertise to people who need it. And one thing also, it allows me to do pro bono autopsies. So in imminent pathology, I've actually done 136 autopsies for free to date.
Oh, wow.
So I can do
Wow.
that because I'm independent. Gives me
Okay.
allows me to have a charity as far as associate with my company as well.
That is awesome. So you really have a heart for
I do.
this and how do families feel when they, may want to know a little bit more about what happened, especially if they have a stillborn and then they run across your organization and they realize that there's a way to possibly get that? Tell us about, not, of course, not specific information regarding families, but how does that make them feel?
I I personally feel like it gives more emotional closure. I have moms and grandmas hugging me. So being independent also allows me to sit down with the family. So instead of getting an autopsy report in the mail, I sit down with each mom. Usually I'm in the hospital before she actually leaves the hospital. And I sit
Oh,
down, I
wow.
explain to the families what happened. I kind of walk them through what can be done for the next pregnancy. I tell the OB as well, but I like to tell the patients. But of course, since my son had to walk through his daughter loss when he was 8, I also talk to the children. So if they want to bring the siblings in, I kind of explain them what happened. So they know that it wasn't because they tickled mommy too wrong. You would be amazed what little kids think that maybe because mommy yelled at me. So just being able to break it down and
Oh
explain it to the babies, and they're not always babies; they might be teenagers. To explain to
no.
them what actually happened, and
That
also let them
is that
know
I'm
that
so
there's a
glad
low
you
risk.
brought that up. I'm sorry, go ahead.
I was gonna say, and also let them know the risk of recurrence. So they're like, well, mommy lost my little brother, and say there's a 2% risk of recurrence, so it's probably not going to happen again. And telling a kid that, it just opens up when the mom gets pregnant again, they're not as nervous. Because my son went through a lot of anxiety when he lost his sister, but no, the information helped a lot.
Because you prepare, like they see you buying the diapers and the wipes and preparing the room, plus or minus gender reveal, plus or minus
Exactly.
baby shower, whether it's in person, virtual, or what have you. And then it's like you kind of work up to this point where you expect, baby brother, baby sister, and then that moment comes and like they're not there for that can be, kids don't necessarily know how to process that. So I
Exactly.
can see how that can be life changing for not just the mom, but like all the families, because people just don't. You want to know, you like, what could I have done different, or did I not eat right? Did I not, do I'm sure there are so many questions that are going through the families during that time.
Right, especially even dads. You would be surprised how dads are traumatized from that because that was their little baby girl, little baby boy. So my whole
Hmm.
family's walked through it. So it helps me to be able to walk families through and tell them what the next steps would be and just let them know
That's
what to expect to see. It's like your child might start getting upset all the time. It's okay. Just give them love. So I can give that kind of advice as well.
right. And it's so powerful. Of course, I would not have wanted you to go through what you went through, but I'm sure that it adds another layer of just appreciation. I'm sure if you feel comfortable, you can share your story with them. If, just to kind of show, hey, I'm not just a doctor, like I actually went through this myself.
Right. So before my daughter actually passed, I had already done over 100 autopsies. So I was well acquainted with it. But it wasn't until um, I went to get my ultrasound one day and my son was going to the gender reveal at the OBGYN clinic. And then they said no heartbeat. And of course, his question was why? And here I am, an 8-year-old starting to cry. And of course, I'm like, well, we're going to try to get answers and everything. So I was able to kind of walk him through. Even though I was in pain, I was able to walk him through his pain and my husband through his pain as well. Because when I was told an autopsy needs to be done, I say, hey, I'm an expert. I do non-invasive, and I hate to say this on public, but I actually did the autopsy of my own daughter, which was one of the hardest
Really?
things I've ever done. But I had to perfect the non-invasive autopsy, so I never had to cut on her with a blade. So I called the nurse in, called the OBGYN and said, this is what happened to my daughter. This is risk recurrence, and this is what to do for the next pregnancy. And actually, I had a little boy 2 years later. So they did exactly what I told them needs to be done, and then I ended up with a healthy pregnancy afterwards. And I'm trying to give that expertise out to all those moms and all those parents and families out there.
Right. Now I have to ask. So this was done the same day that you found out that there was no heartbeat, or did you go to the hospital after then?
I went to the hospital and delivered the next day.
Okay, okay. How did you? I'm a mom too.
Mhm.
So I'm just thinking and I know you're a doctor, pathologist, all the things. When did you decide, at what point did you decide I'm going to perform the autopsy?
Well, that's an interesting
Because you
question.
don't plan for it. Like you
Yeah.
went to the OB,
Mhm.
you went to OB that day. Your son was with you, you all were preparing for gender reveal. So of course, that was not in the plan at all. So at what point did you decide you needed to be a part of that particular next step?
Well, of course, when my son said why, but of course, when he said why, I had the same thought. And one thing I always tell people is sometimes if you don't know why, and the OB said he didn't know why as well, if they don't know
Hmm.
why, then you need answers. I needed an answer. I wanted an answer. So I decided that day that I wanted an autopsy even before I delivered.
Wow. 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 I don't have any other words to say. Just that one word, just wow.
Yeah.
All right. So, Dr. Delicia, I know you said that sometimes moms, they unexpectedly have may have a complication where their baby doesn't make it after delivery, or if they go to their OB appointment and unexpectedly, like what happened to you, there's no heartbeat, and then they ultimately have a stillborn. Tell us what that looks like after the mom delivers in the hospital, and then you come in at that point, and kind of what your process as a pathologist looks like with the mom.
So as a pathologist, I get the call. I personally drive to the hospital. I go and I talk to the OB and the delivery nurse, and I go and sit down and talk to the family. I ask about their medical history, ask any questions they need, and I explain to them what I'm about to do. Then I swallow their little infant and take them with me to one of the side rooms so the baby never leaves the hospital. I examine the baby and I swallow the baby back up and hand it to the mom. And of course, during the time I'm away with the baby, I've looked at the medical records. I may have done some x rays, and I treat this baby like this baby's my own. And then after I have the answers, I go sit down with the mom. I have her call into the room, or she can video call anybody who she wants to know answers. It could be a grandparent, it could be the child they want into the room. And I tell them, let me know when you have everybody you want in the room. And I sit down and I explain to them the cause of death, the risk of recurrence, and what the doctor can do to help with the next pregnancy. And I answer all questions face to face. We hug sometimes. Some I cry with them if they cry. And if they want, I always offer to pray with them because I know it's a very hard time. But I answer any question why they have, and then I give them my personal cell phone number if they have any questions later on. And then I
That
also
is
ask if
amazing.
they have funds for burial because I'm partner with Job, which is another nonprofit that pays for burial. So we have patients who actually get a free or reduced cost autopsy and a burial.
That is amazing. That is amazing. That is such a huge ministry that a lot of people wouldn't think about as being a ministry, but that is, life is so precious and important, but end of life, and making sure the family that's left behind, that's just as important. So we really appreciate that being an option for families, with the reduced or no cost or low cost autopsies, as well as the partner organization for the burial. So thank you all so much. All right. All right. And so if there's one thing that you wish that the public understood a little bit better about pathology, what would that be?
I would tell people that pathology is not scary. So, and sometimes pathology takes time. So, I want people to know that as a pathologist, we're detectives. We're here to give the answers that you need. We're here to answer the question why. Don't be scared of why. Don't be scared of autopsies because sometimes an autopsy can be the only way to get the answers you need, gives you emotional closure, but also can guide therapy for you and your siblings, siblings of the children, or just everybody in general. So don't be scared of us. Just know that we're trying to help you.
Right, right. And as far as when you think about you're providing answers, whether it's, on the laboratory side, which is still laboratory involved with that. But as far as legacy, so which this could look, and however your answer is completely fine. Like I like to ask the guests, like, what is something that you, or what advice would you give to families about building a healthier legacy? And you kind of said some things earlier that kind of went into that. When you think about legacy building from a pathology standpoint, or if you want to just take it from like a general standpoint.
So, what I would say as far as legacy is in your pain, think about how you can help somebody else. So, me, of course, my daughter passed, but because she's passed, over 135 families have been helped. So, think about what's your next step. I always tell every mom, cry when you need to cry. Cry when you stop crying. Decide what you're going to do. So this, you can mourn the rest of your life, or you can go and try to do something for other people. For example, one lady I know who lost her son, she actually started a nonprofit called Job that pays for burial. So she provides free burial for babies who are stillborn. So I mean, we kind of go somewhere with that. But as far as me and my personal legacy, I'm trying to spread autopsies, trying to get the information out. And hopefully at some point, I'm hoping some politician picks this up because honestly, autopsies should be covered by insurance or the government should pay for it. I mean, we have over 400 babies die in Alabama each year. And of course, the state doesn't know why. You don't know why without autopsies. And patients cannot afford autopsies, they're very expensive. So my
Right.
legacy
And
is I'm hoping a politician picks it up at some point and gives patients the answers they need.
well, I pray that they run across this podcast interview and they see the work that you're doing and how you're able to help families and see the importance of it. And just to give us an idea, and I know it can vary from state to state, and maybe situation to situation. I'm not sure. How much does an autopsy cost for,
So
is it different for um, babies or kind of children and then like adults?
So most universities charge about $5,000 to $6,000 for an autopsy. So it's very expensive. The non-invasive autopsies are only about or less than $2,000. So they're a lot
Okay.
cheaper. And that's the reason Priscilla's Path right now covers mostly non-invasive autopsies. But they can be quite expensive. But at the same time, they save you as far as the mom mentally. If you get the answers, you don't have all the mental trauma. Some women actually lose babies after stillborn because of all the stress.
Mm,
So it gives you emotional closure. You wouldn't have quite as much depression. You wouldn't have as many maternal suicides because they have answers. And I mean, that's for everybody in the family, emotional stress for everyone in the family. So it gives answers, and plus it gives you clinical guidance for next pregnancies. So overall, even though they're expensive, they actually save money in the long run.
okay. Now you mentioned Priscilla's Path. It's that the nonprofit portion of your M&M. Explain the difference between those.
So Eminem started first, but then I realized I can't do all autopsies every day for free because I mean, 100 and almost 130 something autopsies done in 5 years. I mean, that's a lot of time taken away from the clinic. So I was trying to do Priscilla's Path so we can send autopsies to UAB and other universities to do that as well. Also, so we can eventually do genetic testing. And plus, people get a write off. So if a church says, hey, we want to pay for somebody's autopsy, or we have friends or neighbors, you can have a way to pay for autopsies because most universities they need the entire amount up front. A lot of people don't have $5,000, $6,000 laying around. So Priscilla's Path,
Mm-hmm.
they can come and say, "Hey, all I have is $100, but I need answers." Priscilla's Path would cover the rest of the autopsy, and I did that so people can donate from the community to support all these women.
Okay. Now, that is great work. Now, how do we donate to Priscilla's Path? Because you're doing the amazing work. I know you've helped so many, over 100 families so far. You said 136 over the
136
past,
exactly.
okay, over the past 5 years. So if we, I don't even want to do the math on that, but if we, like, that's a lot. That's a lot of money. We'll just say that's a lot of money. I won't even try to do mental math on that. So, if people wanted to donate to this cause, how could they give us a website, social media handle, phone number, anything like that? And I'll get your if you have any other ways, PayPal, Venmo, anything like that where people can donate, I'll get that information from you so we can donate.
Okay, just go to priscillaspath.org.
Okay, Priscilla. And will you spell Priscilla's Path.org just because some people may be driving and they hear this? I want to make sure we get all the ways because we need to help these families, you know?
Yes, PriscillaspATH.org. So Priscilla's with the S, path.org.
Okay, that is awesome. That is awesome. So thank you so much for sharing so much information. I feel like pathology is kind of the world of the unknown, and people are really curious about it, and they feel like only a few are called to like, you know, dig into that particular part of medicine. So I appreciate you calling in, coming and giving us some information on that. And do you have, I know you gave us the website, any other website information, social media handles you want to let people know about so they can get in touch with you?
So if somebody just wants to get in touch with me personally, they can always go to mnmpathology.com. That's M, then the word and, then pathology.com. You can find out a little bit more about me, about my training, what other things that I do as well. Hospitals, if you just need some extra pathology support, I'm the person who contracts those things as well. And just to find a little bit of information about me, and also find me on LinkedIn, Delicia Munfus-McCray.
All right. Thank you so much. This has been wonderful. I have learned a lot, and I'm sure our audience has learned a lot as well. All right. So, thank you everyone for tuning in to another episode of Voices for a Healthy Legacy. Again, I am your host, Dr. Andrea, a board certified family medicine physician, and we will see you in the next episode.
All right, thank you so much. Bye bye.
Uh-huh. You are welcome.